I'm going to share the screen. Okay, I'm going to open it up. I'm going to move you guys a little bit off screen. And as you see, it's part 2. Last time, you probably realize how much can go wrong. And as we stay healthier, how lucky we are not to have all those things going wrong. And if you had a look at the notes that I sent out, there was a lot more that can go wrong, which I'll be looking at it in this one here. So this is a list that I sent you in the notes. The first one in the part 1, the first one was the heart, and there are lots of things that could happen with the heart and blood pressure and all that sort of thing. Whereas this time, the first thing I'm starting with is a skeleton. We've had, I can't say the same skeleton because since birth, because it keeps changing all the time, gets renewed and the cells are replaced. That's regular, that's okay. But things can go wrong. So with arthritis, there are 3 different versions of it here. You can take a choice. There's another bit in joints, especially in the leg, the foot, the gout. Now then you get the eye, the cataracts and macular degeneration. And if the eyes can go, so can the hearing. That's a lot easier to fix. And of course, taste and smell change. Then we get urinary incontinence as we get older. Lots of sexual desire, loss of, which includes impotence. And then finally, uterine prolapse. So the bulk of this is really about the skeleton. So arthritis, and most of us probably have some sort of arthritis, and there are different sorts, and osteoarthritis is the common one. So I'll try, but please ask questions if you have issues. I'm not a medico, I may not be able to answer them, but I'll give it a go. So it's really it's swelling, even though it's a bone, you get tenderness around the joints because there's soft tissue within the bones. The main symptoms are pain and harder to move because you get extra bone growth and so on. So then you get the 2 most common types are the osteoarthritis. Now the OS means bone, so that's arthritis of the bone, whereas rheumatoid, the rheum actually means heat, temperature, hotness, and it's an inflammation. It's not extra bone that's growing. It's quite different, and it destroys the lining of the joint. It's very different. So there are other forms of arthritis, and you may or may not have heard of some of these. So ankylosing spondylitis, gout mentioned, and I'll get back to it. There's what's called juvenile idiopathic arthritis. The idio refers to self, as in id, and pathic means disease. So the juvenile, I think it's a genetic issue, and it gets very, very, very difficult. And I remember many years ago, I had a student, a girl, who had this, and she always had trouble moving. She was in pain a lot. I don't know what happened to her, but anyway, it happens. Psoriatic arthritis. Have you heard of? You've probably heard of psoriasis, which is also a form of inflammation. You often get it in the hairline, and it gets not infected, but you get scabbings and all sorts of things. Happens in the bone as well. You get reactive arthritis, septic arthritis, and the thumb arthritis. I'll get to there. So I'm sure some of those you haven't heard of. So osteoarthritis, that's a common one. My wife's got it fairly badly. I've got it in just two places, just in this joint of the thumb. And I take glucosamine and I have no problems. As I forget to take it a couple of days, I'm in pain. So it occurs, this is when the cartilage, and that cushions the end of the bones from running and wearing away, and that starts having a problem, the cartilage. And the osteoarthritis, remember this is arthritis of the bone part, can damage any joint in the body. But because we use our hands a lot and our feet and our knees, it often hurts in those high usage areas. So the hands, knees, the hips, the spine. Now, osteoarthritis, it can be managed. As I just said, I've got it. I'm in no pain whatsoever. But it damages the joints. I've had both my knees replaced because of it. That's okay. Like the $6 million man, I can do all sorts of amazing things. So these very common. And with respect to the development of osteoarthritis, by staying active and not having having a healthy weight, and so some certain treatments that slow it down. It doesn't actually stop it, but it slows it down, and the functionality is quite normal. I thought I'd show you what it looks like. The one on the right is what the knee looks like when bad osteoarthritis. You see the cartilage is gone. It should be sort of fairly high up. There are two pads, one in there and one in there, and they've been worn away, and it's bone on bone there. It grinds the bone away. The best result is with treatment is a knee replacement. So these are very special, made of special metal, made to size. I mean, the surgeon picks the one they needs, so that it goes into the bone. He actually, I don't know whether he uses a bandsaw or what he uses, but he cuts off the top of both bones, and these get put in, and in the middle you see a gap there. Instead of cartilage, it's a very, very high density, very slippery plastic. And I'll show you. I've had it for many years now, both of them, and I've had no problem. It's a wonderful invention. So, by the way, that's not mine. I just picked it off the internet. Now, osteoarthritis, they develop slowly. People just don't know they've got it, and all of a sudden they start feeling pain. So what are some of the signs and some of the symptoms of it? Pain. And if you know anybody with it, I can assure you it hurts. While you're moving, and then sometimes actually, from memory, usually when I stop, it stops hurting. But with some people, when it's quite severe, it still hurts after they stop the movement. For some people, it's stiffness when you're waking up in the morning, or you're sitting there for a couple of hours. It takes time to sort of maybe warm it up. I'm not sure, but it hurts until you sort of wear it in a little bit. So pain comes into it, and it's tender, light pressure. You have that like areas of the thumb. If you pick up something, I can tell you that before I started with glucosamine for these, I could not hold an A4 sheet of paper between my my finger, my thumb. I couldn't pick it. It hurt so much. I couldn't hold it. So even light pressure. So you lose flexibility, and the joint just can't do it anymore. There's sometimes when it's bone and bone, you actually get a grating. It's like a strange situation. The grating feeling in the joint. Some people hear popping and crackling. Popping normally is when the joint moves and the fluid, it's called synovial fluid, moves from one side to the next, but it goes at fairly high speed and it sounds like it pops. Normally, that's not a problem because the bones are separated. When they're together and they move, you get a popping noise. It's the movement of the fluid there. Then you get these spurs. Now, a spur is an extra growth, and it's like little hard lumps that grow, and that can be extra painful. That's the bonus part. Yeah. Then of course, when you have inflammation there, you get swelling, and that's soft tissue swelling there. So what could cause it? Well, usually the cartilage, the piece of cartilage, and we've got cartilage all over the body, it slowly deteriorates. Why deteriorates? I don't know. So some people think it's a genetic issue, but they just deteriorate and eat the cartilage away, and then you get to the bone and bone. So normally the cartilage makes it slippery, so you can move quite easily without pain, just frictionless. Now, if the cartilage wears down fully, that's the bone and bone. It just rubs, that hurts. Osteoarthritis has also been referred to as wear and tear disease. Yes, I agree with that. Besides the breakdown of cartilage, it actually affects the whole joint. Even if one part hurts, it affects the way you walk. And it does. Now, it causes changes to the bone, and this deterioration of the connective tissue, the bits that hold it together, all deteriorate, and you have, and even the tendons are affected, the ones that attach the muscle to the bone. And and if people, so the problem is today, hospitals are public hospitals have problems finding enough time to do all the people in Melbourne, for example, who need this sort of repair, replacement. And there are people who go for years, 2 years, 3 years, in pain because they can't get to hospital. Luckily, we've got private, I'm sure all of us, private hospital coverage, and you got the doctor, yeah, I'll see you in 2 weeks or 3 weeks, whatever it is. But unfortunately, there are lots of people who can't do that. And now, the joint lining, I haven't mentioned, every joint, as well as what's inside the joint, has got a lining, a tissue, and that holds the fluid in, holds everything together. And then once everything starts falling apart, then that tissue, it's a living tissue, it starts inflaming also, and it's painful. Again, that tissue, by the way, just disappears. It gets cut out when the two ends of the bones, the two bones, are sawn off. Of course, that lining disappears as well. So here's another diagram. This is a normal knee. There's your femur, there's your tibia, there's your fibula. So there's under the bottom, you've got cartilage, which is very, very firm, but has it's a bit of it's got sponginess, the firm sponginess. Then you've got the cartilage around there, and this is the problem. When this cartilage here starts to wear away, then you end up with something like this. And the bone deteriorates and deteriorates, and you end up with bone on bone. And you get little spurs forming as well, and that adds to the pain. So what are the risk factors here? First of all, you don't really get it till you're a bit older. I'm not saying any of us are old, but older, sort of 40, 50 up. Then the sex of the person, women are more likely to get it. And no one can explain why. If you're overweight, because of the weight on the joint, you've got a problem with that. And also they discovered recently, this is something new I didn't know, but fat tissue, the tissue that holds the fat cells, it produces some proteins that cause inflammation around the joints. So you sort of lose out two ways. One, because of the weight, and two, because of these proteins which affect the joints. There are also joint injuries. So if you fall over in a sportsman, or you fall down some steps, or do, I don't know, whatever, it can do it. It can affect it, but it could take some years before it develops, or it slowly wears. It wears away the cartilage and so on, and you get it. It may take time or may not. It just depends. Now, if you're a runner, or you play some sort of sport where you're pounding your knees constantly, that over time will also give you that same problem. Now, this is the genetics bit. Some people actually have an inherent situation where they will develop it, and we have no idea why. What happens? Then some people are born with bone deformities, and the joints are malformed or they're defective with respect to the cartilage, and then from young kids, they have problems walking after a while. And there are metabolic diseases, so people with diabetes, or people with hemochromatosis. Oh, the spelling mistake there, sorry. I left the A off in hemo. Hemochromatosis, my brother-in-law has it, and his body produces far more red blood cells than his body can handle, and if they don't remove the excess blood cells, the whole body will just come to a whole grinding halt, because there are too many blood cells for the blood to flow smoothly. So I can't remember now, but every month or so, he has to go and get the letting of the blood, so he's normal. Then the other common one is rheumatoid arthritis, and it's a chronic inflammatory disorder. That's what they call it, and it affects more than the joint, because it can affect things like skin, eyes, lungs, heart, and blood vessels themselves. So the arthritis is inflammatory rather than destructive. It's an autoimmune disorder. That means auto means self, and it's yourself, your own immune system has a problem. And it's when but the person's immune system mistakenly mistakenly identifies as self tissue, our own body tissue, and then it starts breaking it down. Yeah, not much you can do with that. So it's not a wear and tear damage like the osteoarthritis. It affects the lining, not so much the bone. And you get the swelling, and you get the bone then, because of that, erodes, but it's not the actual problem. And then you get the deformity. And the inflammation associated with this can damage other parts of the body, which is what I mentioned further back and up here as well. So the new medications, of course, people are working on all this all the time, and it gives options, but I don't know anything about those new medications. They're just too new. I haven't looked into it. So in rheumatoid arthritis, is a diagram, nice and healthy joint, the meniscus, there, the cartilage underneath, and the bones, the cartilage attached to the bone above, move smoothly. Here, where the cartilage is worn away and the space between them is reduced. See, it's the same as wearing of the bone and wearing of the cartilage in osteo, but here the cause is quite different. There's another thing here, this word synovial. The synovial membrane is a membrane around the whole thing through which the synovial fluid is there, because the bone has fluid in it. It keeps it nice and moist. Lubricated is the word. And it causes erosion of the bone. It's not inflamed, it's just missing. And there's symptoms, well, it's tender, it's warm, it's swollen, and you get stiffness. And apparently, after you've been sleeping, get out of bed, or if you've been sitting in your armchair for a while, it's apparently quite difficult to stand up and move. And then I suppose it's like a cold car. It warms up and off you go. You get very tired. Don't forget, when you're in pain, it tires you. You just feel so bombed out when you're really tired, when you're in pain, and you get fevers in this situation because it's an an autoimmune disease, and you lose appetite as well in this situation, which is good in a way if you're overweight, and that reduces the pressure. But I don't know how long that goes on for. And it's interesting that early on, when the whole process starts, it affects the smaller joints first, like the fingers and the hands and the toes, and then it keeps moving around, changing. So when it progresses, the wrists are affected, the knees, the ankles, elbows, the hips, shoulders. So all of these different things, not at the same time, are affected because the cartilage, this cartilage between every bone, every two bones, if you like, and we've got lots of them, they're all affected. Now, this is interesting. About 40% of people, this is a symptom of rheumatoid arthritis, about 40% of people with it experience signs and symptoms that don't involve the joints. So things that can be affected with these people, I just mentioned that it moves around, but eyes, lungs, skin, heart, kidneys, salivary glands, nerve tissues, bone marrow, blood vessels. So rheumatoid arthritis even though it's got the word arthritis in it, is not necessarily with the bones. It could be, but it could be anywhere else in the body. And again, the signs and symptoms may change or they may vary from person to person, but the severity can come and go. So you could have a lot of trouble with your hand, and then it just disappears. You could have problems with your back. The problem is once it gets to the heart, then you've got a problem, a real problem. So the periods of increased disease activity. Now this is interesting. How long each? It's not there all the time, but they flare up. They're called flares, and they have a period of remission, a period of flares, and then during the remission, there's no swelling, there's no pain, everything's fine, you're cool, doing your own thing, and then it starts up again. Why? No idea. But the problem is it deforms the joints, and once the joint is deformed and it moves out of place, then you've got soreness, you've got a problem. So it's just the causes, it's autoimmune. The immune system normally protects the body, but in this case, it attacks the body. And it attacks healthy tissues. And it also causes, it's that heart problems, lungs, nerves, eyes, skin. And again, they don't know why. And there seems to be a genetic component, but they haven't been able. When I was writing this up, I just tried to find something. I couldn't find anything giving me any ideas of how or why. Now, while genes don't cause it, it's not the genes that do it, they can make the person more likely to react to environmental factors like infection from viruses and bacteria. And apparently, the thought is that if you've got a viral infection, bacterial infection, it could, having the genes for this sort of arthritis, that's triggered. Again, it's a lot of work going on. The risk factors, family. So it's similar to genes transferred from body to body and from person to person. Age, the many types of arthritis, but the probability of getting it increases with age. And if I was in front of you, we're just chatting, I would ask for a show of hands of those who've got some form of arthritis, and I'd probably get a few of them. Women are more likely than men to develop this rheumatoid arthritis. Well, most people, or the people who have gout, and another type of arthritis, are men. More men have gout, and they've been put down in one stage to alcohol. That doesn't seem to be the common thing today. Previous joint injury. So I know you hurt your joint somehow, you twisted it, you fell over, you broke it, anything. Over time, that could well develop into some form of arthritis. Obesity, of course, is an issue because it puts a lot of stress on the joints. And the main joints are the knees, the hips, and the spine. And so they have a higher chance of developing it. There's another form of arthritis called ankylosing spondylitis. And it's an inflammatory disease again, but it affects the small bones in the vertebrae. And it affects them in such a way that they fuse together. So this fusion it makes the spine less flexible. So they have problems bending, picking up things off the floor, whatever, and they sort of look like they're hunching forward. Now, the ribs can also be affected, and that affects their ability to breathe deeply because I don't know if you know the ribs have a joint in the front to the sternum, not all of them, most of them, but the joint to the backbone of the back. So if they don't have the flexibility, you're going to have trouble breathing, which is another problem. And it affects men more than women, as opposed to the rheumatoid arthritis. And signs and symptoms beginning early adulthood. So people in their 20s and 30s, they start getting this inflammation in various parts of the body. Most commonly, for some reason, it's the eyes. I was so surprised when I found this. I don't know why. There's nothing written about it. And when I was looking, but the eyes first are inflamed, and that seems to lead on to something. No cure. There are treatments to lessen the symptoms, but it might slow it down a bit, but it doesn't stop it. So here, for example, is a standard section here of the lumbar region. Each vertebra, one vertebra, two vertebrae, that's an E on the end, and there's a little tendon, the discs are there. Here, you'll see the discs are worn away almost, and they're fused. There's a fair bit of fusion. You can see these little, see here on the left, there's no link, no connection between the two vertebrae. Here, you get little spikes forming. Here on this section here, the nice pink cartilage there. Here, there's not, and often you get the fusion there. So you get this sort of curvature with this condition. So the symptoms, early symptoms, that you get pain and stiffness in the lower back, and that's why the diagram is showing it. And in the hips, especially in the morning and after period of inactivity, the same as the others, other forms of arthritis. Neck pain and fatigue are also common. Fatigue maybe because you're just fed up with the person's fed up with the pain and the difficulty in movement. So this over time it gets worse. Or it could improve, stop, but it just keeps on going. It might stop for a bit apparently, but it'll just, or might improve a little bit, but it'll keep on going. You never get rid of it. The areas most common are the joints between the base of the spine and the pelvis. I can go back to that. This area here linked to the pelvis. So that's, and the vertebrae at the lower back are the places where tendons and ligaments attach to bones around the spine mostly, and sometimes at the back of the heel. So, and then between the sternum and the ribs. I said some of the ribs are attached to the sternum, the breastbone, and so they can move. There's cartilage, but it could happen there too. So then you got problems breathing again. Okay, so and the hip and shoulder joints. So if you think, what other joints have I got? You've got a few, but you're not very comfortable at any time. The cause has no known specific cause. I looked around, I couldn't find anything. It seems to be genetic, and there are risk factors. So one of the risk factors is being a male. You have a higher chance in women of getting it. Age is a problem. It could occur late adolescence or early childhood, but that's not common. Hereditary, there's a gene called the HLA-B27, and there are many people who've got this gene, but it never sets off a reaction. So why some people get it and others who've got the gene don't get it, there isn't an answer. And the complications, and when it's severe, where it's inflamed, new bone will be formed. The problem is the bone that's formed is not formed to order. It just grows, and that causes bridging between gaps. So then it fuses the vertebrae together, as I showed you back there in the diagram. Then the spine becomes stiff, totally inflexible. The fusion might get worse, and with the rib cage in the back and the front. Because I don't know if you realize, every time you breathe in, especially with a deep breath, the rib cage moves out and up because of the structure. That won't happen. So you run out of breath. You just can't get enough air. You just won't be able to breathe deeply enough. Other complications, eyes. I learned a new word. I didn't know about uveitis. It's eye inflammation. And one of the most common complications is this. And it's very rapid. You have high sensitivity to light and the vision is blurred. And you get compression fractures. The bones are eaten away and you get compression. You get the vertebrae crumple. And because of when you're stooping forward, the pressure is not evenly set on the two vertebrae. So if you're leaning, you get pressure where one vertebrae is on another, and if your bone tissue is disappearing slowly, then you get a crumbling effect and you get fractures. And finally, heart problems. And it can also cause problems with the aorta. That's the main artery. Not nice. So the aorta can enlarge to the point that it distorts the shape of the aortic valve. The aortic valve is the valve where the aorta comes out of the heart. And if it distorts the shape of it, it can't work properly. Enough. Let's go into something a little different. Gout. Now, gout is an old-fashioned sort of, men got it mostly in the foot, and we get redness, tenderness, swelling, and it always seems to often start in the big toe. If you see diagrams of it, usually the joint of the big toe looks swollen and it's colored red, and people have a lot of trouble walking with it. So this attack of gout can occur quite suddenly. People they wake up in the middle of the night, and I've read, as I was reading about this, apparently it feels like it's on fire. It's so hot. And this hot, swollen situation is so tender that the bed sheet on top of the toe is it's so painful. They have to find a different way of lying in bed so you don't get this pressure. Doesn't sound very nice either. So these gout symptoms, they may come and go, but apparently it's quite manageable. Symptoms, they occur suddenly and often at night, no idea why. You get this joint pain, very intense. Again, the big toe, but it also affects ankles, knees, elbows, wrists, fingers, all these joints. And the pain is limited within the first 4 to 12 hours after it begins, and then it fades away. How often it happens? Well, that's another thing. Lingering after the severe pain subsides, it just eases off. The discomfort may last a few days to a few weeks. You never actually get rid of it. You live with it apparently. And as time moves on and you get attacks later on, the whole bizzo of pain and then the relief of it, but it all lasts longer and affects more joints. And a lot of people, I've read, people with large spread of gout just want to commit suicide. They just can't handle the pain. But I think with modern, that's what it used to be, the modern medicine helps a fair bit. Inflammation, redness, joints, not good. That's the problem. If you get this pain every time you move, you limit the range of motion that you're willing to go through, so you don't get the pain. So it's a self-limiting situation. So I found this, joint diseases, the whole series of these diagrams. So gout in the fingers, in the knees, ankles, the big toe, it can cause, now I haven't mentioned the cause of it yet. You may have heard of uric acid. You may have heard of urea. Now, urea is what we urinate out. And if we have any uric acid, it gets broken down to urea. Uric acid is not water soluble. So, but whereas urea is very water soluble. Animals that live where there's little water don't produce urea, they produce uric acid. So if you've ever had a bird poo on your car, if you notice, you get a white splotch, that's uric acid. And if you look in the white splotch, there's a dark spot, and that's actually the feces. Birds only have one opening and everything comes out at the same time. Now, birds don't need to drink much because they don't use much water. And you get animals like ants, let's say insects or arthropods that rarely drink any water at all. And their fecal matter, the feces, their poo, if you like, is pure, almost pure uric acid. Now, if you've seen fly droppings, you see little spots. That's uric acid with whatever's left over from what they've eaten. So uric acid is very important to some animals. If they had to produce urea, then they couldn't survive in their environment because there's not enough water. Symptoms, get it, inflammation and redness, you get temperature of the joint goes up. There are drugs, anti-inflammatory ones, and painkillers. Now, sedentary and obesity is a problem. Harmful products, it says, especially meat, red meat, and beer. Whether I'm not sure whether it means if you have beer with the red meat or the separate. Oh, by the way, it's interesting that this is an American diagram. 4 to 6% of the population suffers from gout. Now, if you've got 300 million people, that's a lot of people. Now, this is a diagram of it. When you get the swelling of everything in the joint, and you get the uric acid built up. The word tophi, I'm not sure how you pronounce it, tophi or tophi, is built into there. It grows in there, and then you've got problems with movement. Causes the uric acid. A form of it is called urate, and they grow in crystals, and they accumulate in the joint, as shown in the last diagram. And because they're crystalline, they actually reduce, they increase the pain and reduce the movement. So these crystals form when there is a high level of uric acid in the blood. And the body produces uric acid when it breaks down these purines, ATP and GTP. Now, ATP is adenosine triphosphate, which we are totally and completely reliant on for our energy. But there is a small amount of GDP, guanine, triphosphate. But when there's an excess of them, too many, then the body breaks them down, and for some reason, they produce urate, or uric acid, which becomes urate. So these purines, they're found in some foods like red meat, offal, liver, purines-rich seafood, anchovies, sardines, mussels, scallops, trout, tuna. It depends how much you eat, and depends again on your genetics to quite a degree. Alcohol, especially beer, drinks sweetened with fruit, sugar, that's fructose. Remember, there's cane sugar, which is the white crystalline sugar that we put in tea and coffee or cook with. There's also fruit sugar. So if you have a banana, a pineapple, any bit of fruit, and it's sweet, it's not sucrose, it's fructose. And that has a relationship with uric acid. Now, at our age, I don't know if any of you got gout, but if you haven't got it, I don't think you're on the line for it. So we're beyond it now, I'm pretty sure. So uric acid converted to urea in us, small amounts go through the kidney, and you can measure it. But it's because uric acid is not water soluble, but it just moves along with it. Sometimes the body produces too much, and the kidney may excrete too little. So you get the uric acid buildup, and these sharp, needle-like crystals, the urate crystals, form in the joints, and that's pain, inflammation, swelling, simply the standard sort of words. The risk factors: people with high levels of uric acid are more likely to develop factors that increase the uric acid levels in their body. What we do it, diet, again, what we just said about the food, alcohol consumption, and beer. I don't know why. Weight, again, the overweight problem is the kidneys have more trouble eliminating the uric acid. Medical conditions like high blood pressure, diabetes, obesity, metabolic syndrome, heart, kidney problems, family history. then there are some medications which for some reason, so a low dose aspirin. Now, I have to take 100 milligrams of aspirin every day because I had a heart operation, and I fall into this category. Some medication control for hypertension, I don't have that, but others, diuretics, ACE inhibitors, beta blockers. ACE inhibitors are for lowering blood pressure. So these can increase the uric acid levels. So can the use of anti-rejection drugs prescribed to people that have undergone organ transplants that have these things. So these anti-rejection drugs can also have a problem, cause a problem. Age and sex, mostly men, women a little bit. They have, for some reason, women have a lower level of uric acid level in the body after menopause. However, the uric acid levels approach those of men's. So maybe the active female sex hormones somehow keep the uric acid levels in women, younger women, down. So men are more likely to get it between 30 and 50, generally after menopause. Now, recent surgery or some sort of trauma may trigger a gout attack. And this is interesting. Some people receiving a vaccination can trigger a gout, a flare. Weird, I don't know. And the complications, well, they really more severe. Like if it's recurrent, it comes and goes. The medication may help prevent the gout attack with a recurrent gout, but if it's left untreated, you get erosion and of the bone, and the joint gets destroyed. And then you get advanced gout. This is moving up the scale. You get untreated gout may cause deposits of urate crystals to form under the skin, little nodules called tophi. And these tophis they develop in several areas like fingers, hands, feet, elbows, or the Achilles tendon for some reason. And they're not painful, but they become swollen, and then you got problems walking if they're down the bottom of your feet. And then during gout attacks, these tophi become tender. And then, of course, the famous kidney stones. Now, kidney stones are urate crystals which collect in the kidney slowly. They grow, and then they grow, and they don't go through the system, so they just grow there and become painful, and you've got kidney stones. And then you've got another problem. Surgery can help. Now, let's move away from bones to the eyes. Cataracts. The lens normally is clear, and at the back of the eye, you get the area which is what we see on this spot there. Goes right through. Now the lens itself, then, if it starts developing uric acid crystals, or I think they are, then the light, instead of coming straight through, gets bent or blocked altogether. It varies. So you get this cloudiness in the lens, and that's the cataract. And so the back of the eye, the macula, I go back. right around the back of the eye, you've got the retina. The fovea centralis is a depression there, and the macula is within that. And that's mostly color cells, cells that pick up color. And it's some black and white, but most of the rest is little color. And normally has to be straight. But the lens starts going. There are different sorts of cataract. I'll go through it, but just be aware that this diagram is just one sort of representation. There's a little link here, and I'm not sure. I've got a lot to get through, so maybe I won't show it, but it's there for you to go back and have a look about cataracts. Now, if you don't have cataracts, everything you see is crystal clear. The colors are the colors, lights and darks, everything's good. Once you start getting little crystalline growth within the one lens or both, the light coming through is diffracted. And that means it's not going straight through, and then things start looking blurred. They may be hazy, they may be not as colorful. So some vision changes with a cataract. Blurred vision, double vision, because whatever's coming in may be split by the little bit of growth there. It's not tissue growth, it's crystalline. Being extra sensitive to light, because maybe the light is actually split, so you get double dose. Having trouble seeing well at night. Now, night vision is very important, but if not enough light is coming through at night, you might use more light. Bright colors are seen as faded or yellow. Now, this, I don't know the reason. I'm just guessing that certain light frequencies change. You might miss some of the higher frequencies or the lower frequencies, I'm not sure. You see halos around lights. So frequent changes in glasses or contact lens prescriptions, and the fading or yellowing of colors. So it's really strange. This is what it looks like when it's gone a fair way. It's left one is, well, the right eye there on the left, normal. It's the other eye, and the lens is wide open, and it's all completely opaque. That person was blind in that eye. So what's causing it? Aging is the most common reason. And so when we get to 40-ish, the eye tends to change a little bit. So this is when normal proteins in the lens start to break down. Now, I don't know if you know, but the lens is actually made of layers, and these proteins are maintained. It's not cellular, it's layered. And people over 60, that's all of us, I think, may start having the clouding early on or sometime, but it may not happen much, much later. Now, so why, besides the cloudiness, there could be a genetic thing, parents with it, or other members of the family. Certain medical problems like diabetes could cause it. Smoking can cause it. If been some eye injury, eye surgery, radiation treatment to somewhere in the body, the upper body. If you spend a lot of time in the sun without polarizing sunglasses, that certainly causes it because more UV gets through, and long-term use of corticosteroids. And I've always insisted on having Polaroid glasses, polarizing. And if you're not sure about whether yours is a polarizing sunglasses or not, it varies to find out. Ask someone else who's got them. If you take two glasses and you hold one in front of the other like that, and then you turn it perpendicular. So the two lenses are perpendicular, and the polarizing, if they're proper polarizing lenses, they will block all the light coming through. So you can't see through the two lenses. If that does not happen, one of those pairs of sunglasses are not polarizing. Most age-related cataracts have a slow development. There are other forms of cataracts which can develop quickly, and these are in younger people and those with diabetes. And they don't know how long it will happen, how quickly it will happen, but it seems to happen. Now, so as we get older, the lenses become less flexible, so we don't have the capacity to move from far to close too easily. They could become less transparent, and they become thicker. So, as related medical conditions which cause tissues in the lens to break down and clump together, and then you get these small clouding bits forming within the lens. So as these four small clumps continue to develop and grow, and they get denser, but it depends on what part of the lens this happens in. So the cataract is actually what it does, it scatters the light that comes in, and you just don't see properly. And to get to the retina, you get this blurred effect because of the scattering of the light due to these little growing crystals in the lens. Now, cataract usually happen in both eyes, but not necessarily evenly, or maybe just in one. So in one eye, it may be more advanced. Different types of cataracts. So this is what I'm saying, could happen in different parts of the lens. So the nuclear cataract means in the center of the lens. So at the beginning, it might cause sort of nearsightedness, and it may also be just temporary. It may at first cause nearsightedness, but you can also have a temporary improvement. But over time, it becomes more dense, more yellow, and just eventually go blind. So when you progress through this process, in yellow it goes to brown, and then once it's like that, you can't tell the difference between shades of. If you look at a color chart, you can't tell the difference between the different shades. The cataracts that affect so that's a nuclear cataract, that's in the middle of the lens. But the edges of the lens, they're called cortical cataracts. And they begin like little wedge. I've never seen them, I don't know, I can't explain it. It's just what I've picked up. But apparently they look like wedge-shaped opacities, things that are slightly opaque or streaks in the outer edge of the lens, and it slowly progresses from the outside, moving in. And so light's being interfered with, eventually, even in the center. And then you get cataracts at the back of the lens, then it's towards the retina. It's called posterior subcapsular cataract. So posterior means the back, subcapsular under the capsule cataracts. And these cataracts start small, they're opaque, and again, they're in the path of the light. So they interfere with reading. It reduces vision in bright light. I don't know why, but they cause a glare, apparently, and halos around light at night. So these type, they tend to progress faster than others do. Why? No idea. Some people, some babies are born with cataracts, and they're called congenital cataracts. And some people with these sort also could develop during childhood. So you don't have to wait till you're in your 50s, 60s, 70s. So these cataracts may be genetic, or they may have, and this is someone's idea, they seem to be associated with intrauterine infection or a trauma happened in the uterus. So there's a lot we still don't know. And these cataracts may be due to other conditions, like myotonic dystrophy, where the body's muscles, okay, myo means muscle, tonic, their state of tonicity, but dystrophy meaning dying away. Galactosemia, that means a lot of galactose, is the form of sugar in the blood. Is the blood. Neurofibromatosis, where you get this is part of type 2, in rubella, or rubella. The nerves are affected, and that causes problems. Congenital cataracts don't always affect vision, but if they do, they're usually removed soon after detection. So somehow they can be removed. Yeah. But I thought just for interest, I'll put them in there. Factors that increase the risk of cataracts include age, increase, diabetes, of course, we mentioned a number of times, excessive exposure to sunlight. So people who love lying in the sun and sunbaking, but they don't wear sunglasses because they don't want the extra white back. The sun actually goes, the light, high intensity light still goes through the eyelids. And I should actually mention, that's sort of an interesting point here, people with Asian origin, as you probably know, have an extra eyelid. And the theory, maybe it still wasn't hypothesis, but the idea is that as the people that when they left 200,000 years ago, they left Africa, some went to the left, some went to the right, and some went north. So the ones that went north went up to what's now the Himalayas, and they were able to live high up, but they were forming cataracts. And through evolution, some developed these extra eyelids, which reduce the amount of UV getting through to the lens. And the current thinking is that's how the Asian eye developed, as a barrier to destruction of vision. I hope you understood that. A good one. So lots of sunlight. Yeah, smoking affects that terribly, and obesity again. High blood pressure is not a very good thing to have. Previous eye injury or inflammation for some reason sticks around. Surgery, prolonged use of corticosteroids, drinking excessive amount of alcohol. Now, the prevention of how do we stop getting cataracts? Well, couldn't find anything. Wherever I looked, they kept saying no studies have shown how to prevent cataracts or even a slow progression. So what doctors are thinking, this is ideas, have regular eye checks, possibly. Quit smoking, medications, counseling, other things to help with this smoking, manage other health problems like diabetes and obesity, healthy diet, lots of fruit, lots of vegetables, not too much red meat, having colorful fruits and vegetables in the diet, add different sorts of vitamins, various nutrients, and they're all very useful. The antioxidants help maintain eye health. And so studies have not proved that antioxidants in pills can prevent cataracts, but a large population studies show that healthy diets do. So healthy diets, rich in vitamins, rich in minerals, associated with a reduced risk of developing cataract. So I'm sure you're all healthy, you're all eating really well. Just make sure your grandkids do too. Polarizing sunglasses are very important. By the way, there are two sorts of ultraviolets, UVA and UVB. Is the B that causes the problem. That's usually the sunglasses that you buy, which are polarizing, are for the UVB. Excessive alcohol should be reduced. Macular degeneration is something that's the other end of the eye. People have that over 50. It causes blurred or reduced central vision. So the macula, that's at the back where the lens focuses the image, you get it blurred because the macula starts to get thinner and thinner, and so it moves further and further away. So it's a bit harder to get very sharp images. So I just said that. Okay. So macular degeneration is first developed in one or both the eyes, but the vision may worsen, and people have problems reading. They have problems driving. They even have trouble recognizing faces. Maybe shapes will tell them who the person is, but it's really, really difficult. Now, doesn't mean there'd be loss of all sight, but it's vision loss is typically central, it's the middle of the eye, but people retain their peripheral vision. So you can imagine if you're looking at something, what you see around it is what you would see, but there'd be a dark area where you can't see it. Some people have only mild central vision loss, for others more severe, so it depends on the individual. Now the symptoms, the gradual, no pain, the visual distortions, so straight lines seem to be bent. Central vision is reduced in one or both eyes. The need for brighter light when reading, increased difficulty adapting to low light level. So normally, if you walk from if you say you have the sun, you walk into a room, kitchen, wherever, but it's a lot less light. It takes longer for the eye to adapt. And they say, well, if you, I said, a dimly lit restaurant, well, I think from the same to one of those, it takes time anyway to adapt. Increasing blurriness of printed words, decreased intensity or brightness of colors, difficulty in recognizing faces, I mentioned before, well-defined blurry spot or blind spot in the field of vision. You can see everything except there's a little spot there which won't go away. And it affects one or both eyes. If only one eye is affected, people may not notice any change because the good eye will compensate for the other one. And the condition doesn't affect peripheral vision. Not so. Macular degeneration does not cause generally total blindness. Now, it can develop to what's called neovascular macular degeneration, where the blood vessels that grow into under the fovea centralis at the back, which supports the macula, the blood vessels start to leak, and that causes problems. So, so here's an idea of the eye in line, dead straight line here. There's a depression. The depression is called a fovea. By the way, that's misspelled. But I couldn't find a better diagram, so I kept that one with a misspelling. In the middle of that fovea is the macula. Underneath that are lots of blood vessels. Then you get, which you can't see, what's this orange thing called a choroid. That is the color of dark chocolate. It's a membrane which stops light leaking through the side of the eye. And the white of the eye is called the sclera. Again, another spelling mistake, there's no second E there. And it's a very, very tough tissue. At school, we used to get kids to dissect sheep's eyes, and they had problems cutting through them. It's very, very tough, and it keeps the shape of the eye. So, under normal conditions, an optometrist looking through will see that there's a fovea. Sorry, that's the nerve. That's the fovea with the macula. And again, not quite right, but it's close enough. But what happens here is you get a hemorrhage underneath, right? And that leads to what's called atrophy, where the tissue breaks down. And you can also get little spots of this atrophy as well. So the degeneration of the macula due to the blood there affects, well, people can go blind. Now, hearing. That's something else that comes on fairly gradually. Now, presbycusis. Now, cusis is like as in percussion, something you can hear. The presby, nothing to do with the church. Presby just means old. And so that's quite common. And more of us are into the hearing age. The hearing loss is defined. So it can be there's three types of hearing loss. Conductive means it involved the outer and the middle ear. I'll come back to that in a minute. The sensory neural involves the inner ear. There are three levels. there's a mix, a combination of those two. So I'll explain this, I think, as I go, except the word conductive means that it conducts, the bits that conduct the sound start seizing up. Now, I'll come back to it. So aging, chronic exposure to loud sounds affect hearing. Other things like excessive earwax means the sound can't get through. And if you can't hear it properly, hearing loss cannot be reversed. And hearing aids, of course, make a huge improvement. And I put my hand up for one as one who has had a dramatic improvement. Okay, here is a diagram. The outer part of the ear is called the pinna, the ear canal, and it stops at the eardrum. So this is called the outer ear. The the middle ear has got three little bones. Now, in Latin, the word for bone is os, O-S. So because these are absolutely tiny, they're called ossicles. Now, they are in an air compartment, which is attached to a tube, which goes to the back of the throat. And that's called the eustachian tube. And under normal conditions, you wouldn't know about it. But if you're in a plane going up or going down, you have to swallow. Why do you have to swallow? Well, when you're at sea level, the pressure in here and the pressure in your mouth is the same. You get in the plane, go up high, the pressure in here, it's still at sea level. The pressure outside here is reduced. Even in a plane, they don't keep it at that pressure, which means the pressure here is greater than the pressure here at the outside. And then so you get a push. On this side, nothing happens because it's all bone. So you get this pain. So they say on the plane, swallow. So by swallowing, you open this tube, and then the pressure, then the excess air comes out and reduces the pressure, then the opposite coming down. All right, so what happens here is these three are mechanically, a mechanical situation, and they perfectly amplify the vibrations of this membrane. So what they do, they reduce the size of the movement, but increase the pressure. And that pressure, that's the stirrup, the hammer, anvil, and stirrup. And this thing here is called the cochlea. It's in bone and it's full of fluid, and it's lined with membranes where you hear it. And they call this bit where this is joined is the oval window, and this is the round window. So as this goes in, with the membrane there, this one pops out a little bit. So as this moves backwards and forwards with the sound, this does too. And then the sound is affected through there. And these yellow things are the nerves that go through. And these are the three circular canals which tell you where you are in space. I don't mean outer space. Just so if you're falling forward, your hands and feet, or 8 foot, may come out automatically because of what happens in here. But that's another talk. I'll leave it now. All right, but just by saying hearing loss is conductive because you can get arthritis between these two, this joint here and this joint here, which means they don't move as freely as they should, and that the sound doesn't get through as easily. And the other one was sensory neural, and that's changes in the inner ear, so outer, middle, and ear. But that's enough detail for now. Okay, hearing loss, muffled of speech, other sounds, hard to hear and to understand words. And if there's other noise in the background, it's even harder. If you're in a crowd, it's hard. It's hard to hear. As you know, I play in a band, and when I play in a band, I switch off my hearing aids, otherwise it gets too loud. But then when a conductor says, let's go back to B or D or some other letter that sounds the same, I can't work out what letter he's saying. So I've more than once I've started in the wrong place, but after that I've learned to ask, can you say, a B for boss or B for beer or whatever. So it's a problem. I can vouch for that. Now, frequently asking others to speak more slowly, clearly, and loudly helps. Needing to turn up the volume of the TV or the radio helps. Some people who just can't hear properly, they actually withdraw because they just can't follow the conversation. Then there's some social settings that some people may avoid because they just don't fit in, they feel they don't. And people are ashamed to say, I can't hear you, or I can't hear you properly. And what's some of the causes? So the inner ear is where that cochlea is. It looks like a snail shell. With aging, and especially with loud noise, the nerve cells and their hairs, special hairs, and they start wearing away, and they're not as receptive. And if they're not receptive, the signal is poor. The signal they're going to the brain is poor. So you get damage, and you get also the whole thing has become totally inefficient, and you get hearing loss. High-pitched tones, they become muffled because of the position. It depends where the problem is in the cochlea, because one end is high pitch and the other end is low pitch. So that gets affected. Earwax, if it's not cleared out properly, then you can have problems with the sound waves just not being able to get through to the eardrum. You get an infection or abnormal bone growth or tumors in the outer or inner ear, outer or middle ear, then you've got problems. Rupture of the eardrum, that is not a good thing to have. So if someone's near a blast, the noise hitting the eardrum could be so great that it'll rupture the eardrum. The sudden air pressures, if you try to clean your ear and you go a little bit too far, you can poke a hole in it. Not good. And that affects hearing. Okay, some risk factors that can lead to the loss of the hairs and the nerve cells in the inner ear. I haven't gone into any detail of that. That'll be another time. It just takes a little bit too long. Aging is a problem, and that's okay. We get used to it. So the inner ear, the inner bit where the cochlea is, degenerate over time. Loud noise I mentioned, and that can affect. And today, wherever, I don't know, in the building area or wherever you are, there's a chance of some sort of a blast or gunshot, let's say a sudden shot, the air pressure caused by that could rupture the eardrum. I've been in brass bands in school days, and where I sit with my instrument, I have trombones behind me. And when you've got 3 trombones, full blast, this is, and I think that's where I lost some of my hearing. And it happened every week for 2 hours. Hereditary genetics could make you more susceptible to ear damage, or deterioration from aging. Where you work, if you work in a factory with a lot of noise, it could affect the ear. Recreational noises, like people like shooting, people working with jet engines, are very high sound, can cause immediate permanent hearing loss. It really can affect the nerves badly. Okay, another one here: motorcycling, carpentry, listening to loud music. I'll put my hand up for that one, but only in band practice. Some medications, apparently, there's an antibiotic called gentamicin, another one called sildenafil, Viagra. Some guys use it to improve or get an erection, and certain chemotherapy drugs can damage the inner ear. Now, when they started pushing Viagra, I don't think they knew about the effect. And you get temporary effects like ringing in the ear, the tinnitus. You just get this like a ring or a buzz. I used to have it, and that may have been to do with the brass band. I don't know, but gone now. Can occur. It's going to occur in very high doses when aspirin's taken, anti-malarial drugs, or loop diuretics. So there, some illnesses, can result in high fever, like meningitis, and they may damage the cochlea. Well, that's the end of that bit. Now, what I've done here, I found this list. I thought you might find interesting. The number of decibels and the noise source. So you've got the safe range and the risk range. So 30 decibels is if someone whispers, that's fine. A fridge working in the background or near you, about 40. Normal conversation, we'll be talking at about 60. A dishwasher, 75, that's fine. Once you get to above 80, then for a length of time, you've got a problem. Heavy city traffic, I mean, we're in a car, we've got the radio on, the windows are up, so you're sort of cocooned. But if you say a policeman standing there conducting traffic, or I don't know, if there's a lot of traffic and people are standing there in it, could affect it. Like you go to a school cafeteria, this is an American one, so we don't really have them here, but the kids have lunch there, and the noise is very, very high, especially the high-pitched, young kids' high-pitched voices. Motorbikes, snowmobiles, I have no idea. Chainsaws, jackhammers, a rock concert about 110, sandblasting, you have to really, if you're staying in front of an ambulance with a siren going, very loud thunder. Now that's a sudden one that can come above your head. Fireworks, firearms, 140 to 165, really bad. In the notes I sent out to you, there are about 3 pages, much more detailed ones, which you might like to have a look at. You may have seen them already. Now, the complications of hearing loss can really have a significant effect on the quality of life. And older adults with hearing loss may report feelings of depression because they can't hear properly, they can't communicate properly with people, They feel that, they can't respond to what people are saying, and not good. And well, what I was saying, conversation can be difficult, and so they feel the isolation. Hearing loss is also associated with cognitive impairment and decline. So when people can't hear properly, they can't work out what's being said, their brains can't figure out what's going on, but they're probably too ashamed to say it. And so they get this decline. The mechanism of interaction between hearing loss, cognitive impairment, depression, isolation, and being studied all around the world. What can they do about it? One area, of course, is hearing aids. But if it's more than just the hearing part, the other areas further in. In the initial, initial research trained that treating hearing loss can have a positive effect on cognitive performance, especially memory, because if you can't hear it, it makes it a problem. So we get modern hearing aids. Someone sent me something. I don't know. No. When I went to get my hearing aids, I was given a sample and I had to keep changing batteries. And I said, "Don't you get rechargeables?" And he said, "Yes, of course." So there's a recharger, you plug them in overnight, and morning you've got another day or day and a half if you need it of charge. So you don't have to change batteries every couple of days. You get digital networking. I hear my phone through my hearing aids. And I can listen to the radio and music. It's wonderful. The titanium hearing aids are very light, very resilient, they're sturdy. And unless you're looking for them, you don't actually see it. Some of them, they're molded. One, my aunt, who some of you knew about, she had molded ones which fitted in. But she never put them in properly and they kept falling out, so she stopped wearing them so she couldn't hear us. But the molded ones are almost invisible, and they're great. So then, as well as losing hearing, you can lose the loss of taste and loss of smell. So smell and taste actually is expected with aging, especially our age. But there are other things that can contribute to their loss, like nasal issues, sinus issues, allergies, sinusitis, and nasal polyps. They all affect the smell or taste. Now, as we get older, the mouth actually produces less saliva. This makes the mouth drier, which means the molecules in the food that you're eating are not being dissolved as quickly, so your sense of taste is nowhere near as strong. Your sense of smell, of course, may also diminish after 70. This may be related to loss of nerve endings or less mucus in the nose, because the nerve endings in the back of the nose are actually in a layer of mucus. So that could be a problem. The number of taste buds that we have on the tongue and the back of the throat, they decrease as we get older. So from 40s in the female, 50s in the male, you start tasting differently, apparently. Now, I'm not sure if I'm tasting differently or not. To me, it tastes like a taste. But I don't have the memory of what things tasted like when I was in my 30s or 20s. So the remaining taste buds may begin to think, or they atrophy, that means they die away, or have no function at all. Anyway, so sadly, some of us might never regain the sense of smell or taste at all. Now, hopefully, none of us have that problem. He says, according to some experts, patients with post-viral loss of smell have roughly a 60 to 80% chance of regaining some of the smell function within a year. This is brand new stuff. So if you have a viral infection and you lose your taste, you lose your smell, there's a very high chance of regaining it slowly. Urinary incontinence is another problem as we get older. The different types of urinary incontinence is stress incontinence, where urine leaks when pressure is exerted on the bladder. If you cough, if you sneeze, if you laugh, if exercising or lifting something heavy, you just can't hold it back. You get a bit of leakage. You get an urge incontinence. So you need to go to the toilet, urinate, but I'll wait a bit longer. And then you're engrossed with whatever you do. I'll wait a bit longer. And then the sphincter that's holding it back says enough is enough, and it lets a little bit of out. So you get this urge incontinence, and so you really have to go and sort it out. But some of it is normal. Some of it could be caused by an infection or some other things like a neurological disorder or even diabetes. You can have overflow incontinence, like frequent or constant dribbling due to the bladder that doesn't empty completely. So you urinate, and then 10 minutes later say, I've got to go back. I haven't emptied it properly. There's functional incontinence. So there's a physical or mental impairment that keeps you from making it to the toilet on time. And then you have an accident. So severe arthritis is a problem. You need to go. By the time you get to the toilet, it's often too late. Or your fingers might be arthritic, and you've got a zip which you can't grab hold of, or buttons you can't undo, or you can, if you're wearing pants. Or maybe people should wear like tracksuit pants, maybe easier. Mixed incontinence, so you can get more than one type. You get a combination of them. Makes it more interesting, huh? Causes of temporary urinary incontinence, things like the certain foods, medications, and they could act as diuretics, something that makes us want to urinate. Stimulate the bladder, increase the volume of the urine. Alcohol, caffeine, carbonated drinks. I'm not sure why. Sparkling water, I don't know why. Maybe the extra carbon dioxide in them. Artificial sweeteners made, chocolate, which is a shame. Chili peppers, I don't care. Foods that are high in spice, sugar, or acid. So maybe the carbonated drinks could be the acid or the sugar. Especially citrus. I can't do without my oranges. So luckily, heart and blood pressure medication, sedatives, muscle relaxants, low doses of vitamins could do it. Low urinary incontinence may also be caused by an easily treatable medical condition such as urinary tract infection. So infections can irritate the bladder, causing strong urge to urinate and sometimes incontinence. So that can be treated. Constipation, the rectum is located near the bladder and and shares the same nerves. So hard, compacted stools or poo, if you like, in the rectum can press on nerves, which then become overreactive and increase the urinary frequency. and causes of persistent urinary, so the previous one was temporary, persistent pregnancy, of course. Childbirth can weaken the muscles needed for the bladder to control the for bladder, so needed for bladder control, and damage bladder nerves and the support issue. That's a tissue. That's a problem. So you get a prolapse of the pelvic floor, and that means you lose control. With a prolapse, the bladder, uterus, rectum, and small intestines can get pushed down from the normal position and protrude into the vagina, and that causes problems. And that can be associated with incontinence. With aging of the bladder muscle, and decrease in the bladder's capacity to hold it. I mean, when we're young, we could hold it for ages and then comfortably release it. These days, may not be so easy. Also, involuntary bladder contractions can become more frequent as we get older. Menopause is in women that produce less estrogen, and estrogen keeps the lining of the bladder and the urethra healthy. So you get a deterioration of that, which can aggravate incontinence. An enlarged prostate can do that if you still have it. So incontinence from the enlargement of the prostate gland affecting the bladder, and it's known as benign prostatic hyperplasia. The prostate cancer, the stress incontinence or urge incontinence can be associated with that. So that's the side effect of the cancer. Obstruction, a tumor somewhere along the urinary tract, you get a blockage. The normal flow is you get an overflow of incontinence, and that causes problems. Urinary stones develop, hard little stones, uric acid, and then you get leakage, more problems. Then you get neurological disorders, multiple sclerosis, Parkinson's, stroke, brain tumor, spinal injury, can all affect the nerve signals going to the bladder, and then the bladder control is affected, causing urinary incontinence. What else? Weak bladder muscles, and then overreactive bladder muscles, weak pelvic floor muscles, you can't control it. Damage to nerves that control the bladder, and some disease like multiple sclerosis, diabetes, Parkinson's. If they're treated, urinary incontinence can lead to sleep loss, depression, anxiety, loss of interest in sex as well. It depends on your age, I suppose. Seeing a doctor if the condition is causing frequent urination 8 or more times a day, and that's a lot. If feeling tired from incontinence-related sleep loss, then you need medical help. Studies show that reducing caffeine intake below 100 milligrams a day, that's about 1 cup of drip coffee, so it's pretty weak, may help reduce that. 100 milligrams of coffee a day is not very much. Cut down or cut out these problems. Caffeinated drinks like Coke, with coffees, colas, energy drinks, they have them. Gender, women are more likely to have stress incontinence. I mentioned before, pregnancy, childbirth, menopause, and the female anatomy causes problems, which we mentioned earlier. However, men have the prostate issue. Age is a problem. Muscles get weaker. Muscles of the bladder, around the bladder, the urethra, pelvic floor, of course, and Changes with age reduce how much the big bladder can hold and for how long. Being overweight is a problem because of the excess pressure on the bladder from surrounding muscles and tissues above the muscles. It causes weakness and leakage. Smoking it always causes a problem with urinary infection, incontinence, sorry. Family history, people with that. I don't know how that fits into the picture, but there seems to be some sort of a genetic issue there. Some diseases, neurological diseases or diabetes may cause that. Now, complications and interventions, skin problems could result from urinary incontinence, rashes, skin infections, sores, if the skin is constantly wet. So yeah, okay, and personal, your social life could be affected, your work life, personal relationships. The urinary incontinence isn't always preventable, but what can help is a healthy weight, practice pelvic floor exercises to do it, and things like yoga or Pilates. Concentrate on pelvic floor exercises. Avoid bladder irritants, caffeine, alcohol, acidic food. Eat more fiber. So that prevents constipation, which is what we talked about before. Don't smoke, no more said there. Loss of sexual desire. Well, as we get older, a gradual loss of libido. That's the degree of this decline varies. Most men maintain at least some amount of sexual interest in the 60s and 70s. It's good. Sometimes loss of sex drive is related to things like depression, stress, alcoholism, illicit drug use, or fatigue, retired for whatever reason. Sometimes the culprit is a decrease in male sex hormone due to an endocrine disorder. In other cases, it could be the medication's side effect. In women, apparently it's not an issue related to menopause, and this is fairly new. I got that from the University of Southampton and the University of College of London. But what can be the cause is poor physical health and mental health, or a breakdown in communication, an absence of emotional closeness, and a problem. So, a couple getting older, some of these issues could be a problem. Generally speaking, women are more likely to remain interested in sex if they're able to talk about it with their partner and able to share similar likes and dislikes with their partner. Women are more than twice as likely as men to lose interest in long-term relationships, interest in sex in long-term relationships, according to this British study I found up there. For men, the dip in libido was most common between 35 and 44. With women, it peaked between 55, this loss of libido, between 55 and 64. So the women are more active, want more. Erectile dysfunction leads to impotence. Just can't get an erection or can't keep it up. And the symptoms might include trouble getting the erection, trouble keeping it, and reduced sexual desire. And the causes could be problems in the brain, hormones, emotions, nerves, muscles, blood vessels. The erectile dysfunction could be a problem with any of the ones above. Stress and mental health concerns, of course, and it may cause the erectile dysfunction. Sometimes a combination of physical and psychological issues cause it. So, for example, minor physical condition that slows sexual response might cause anxiety about maintaining an erection, and therefore it leads to loss of erection. And what would cause impotence, heart disease, clogged blood vessels, high blood cholesterol, high blood pressure, diabetes, obesity, metabolic syndrome, which causes high blood pressure, high insulin levels, body fat around the waist, high cholesterol, similar to what's a bit higher, Parkinson's, multiple sclerosis, some prescription drugs, tobacco, alcoholism, Peyronie's disease, where scar tissue develops inside the penis, sleep disorders, treatment of prostate cancer and enlarged prostate, or surgeries or injuries that affect the pelvic area or the spinal cord, low testosterone. And what psychological causes of some psychological causes are the brain is very important to get an erection. You don't think about it, it won't happen. A number of things that can interfere with the sex and cause worsening can cause this problem or actually erectile dysfunction, depression, anxiety, some mental condition, health conditions, stress, relationship problems, poor communication, and other things. Risk factors, medical conditions like diabetes, heart condition, tobacco use, because tobacco actually constricts the vessel and restricts blood flow, and that can cause all sorts of problems, being overweight again, certain medical treatment like prostate surgery or radiation treatment after cancer, injuries, damage to nerves, damaged arteries that control erection, medications including antidepressants, antihistamines, medications for high blood pressure, pain, prostate, all those psychological conditions like stress, anxiety, and depression, drugs and alcohol. Uterine prolapse occurs when the pelvic floor muscles and the ligaments stretch and weaken, and they can't support the uterus. As a result, the uterus slowly slips into the vagina. This prolapse in women can occur in any age, but it affects postmenopausal women mostly, and those who've had vaginal deliveries. Mild uterine prolapse usually doesn't require treatment, but if uterine prolapse is uncomfortable, then it disrupts normal life. So this is an example of, there's the vagina, there's the uterus, and that just pops into the back, and then you've got problems. I'm nearly finished, I think. Sensation of heaviness or pulling in of the pelvis is a problem with this uterine prolapse. So the woman feeling all these terrible conditions, and she's got problems. So the tissue is actually protruding out of the vagina, and so they have to have urinary problems like urine leakage, incontinence. That, of course, affects bowel movement because the uterus has moved out of place. Feeling as if you're sitting on a small ball, apparently, or as if something's falling out of your vagina. Sexual concerns, such as cessation of looseness in the tone of the vagina, is another symptom of this situation. And the causes: pregnancy, difficult labor, delivering a large baby, being overweight or obese, lower estrogen levels after menopause, chronic constipation, straining with bowel movements, chronic cough or bronchitis, repeated heavy lifting, and and that more than one or more pregnancies with vaginal births, giving birth to a large baby. I just mentioned age increase, obesity, prior pelvic surgery, chronic constipation, the family history comes into the beginning. Being Hispanic or white. I think, sorry. Oh, gone too far. Anyway, guys, let's finish. It's already, what is it? Wow, 10 to 12. So I will, where am I? Let's get out of this. So I can't remember. It's down. All right, here we are. Okay, there we are. Sorry, so many guys I had to leave. This is why I broke this topic into two, and I ran over time in both of them. So I just, I didn't want to overdo it. So there's a 1 page left. You can look at it later. I'll, the recording is being done. Sorry, Richard, I can see you talking. I can't hear you. Press your space bar. Press the space bar. No, can't hear. Guys, as I said to, I don't know if you were all there at the beginning when I said this is the last one for the year. I'll be in New Zealand at the start of next year. I'll send you the date. And also biology will be face to face and on Zoom, so you have a choice. And also it'll be early March, sometime March, 15th of March. So I can't remember the date, but I hope you have a nice long holiday. But life is a holiday, isn't it? We don't.
Ruben, I just wanted to say a big thank you for a full year of very informative sessions. Really, really appreciate your taking the time and preparing and talking about it all, and giving us all wealth of information. Thank you so much.
Thank you, Preeti. I really appreciate that. Thank you.
Thank you as well. It's been
Thank you.
really informative.
Thanks, Ruben. Thank you.
Next year.
I hope I see you guys next year, and we'll do something different.
Yeah.
Be well.
You have a good holiday. Yeah.
You too. Enjoy the break. Enjoy the trip to New Zealand.
We've been there before, but we're doing parts that we haven't been to before, and a cruise at the end of it. What more can it's wonderful. Life's good.
Yeah, absolutely.
Right.
Thank you.
See you.
Thank you.
Bye
Bye-bye.
bye.
Thanks.
And
Bye.